welcome to another exciting edition of 5 Orange Vibes, where we bring you updates on what UNFPA Ghana has been up to over the past week. In our headlines today, UNFPA Ghana co-hosts the second Private Health Sector Summit with the Ministry of Health and Private Health Sector Alliance of Ghana. A delegation from the Lagos State government in Nigeria pay a learning visit to Ghana. Ministry of Health organizes preceptorship training for midwives in Kumasi. The Ministry of Gender, Children and Social Protection holds a biannual tracking meeting on the implementation of the adolescent pregnancy strategy. And finally, Presidential Advisor on the SDGs, Dr. Eugene Owusu, interacts with the UNI Fellows. And now to the stories. The second Private Health Sector Summit, which took place in Accra, saw stakeholders from the public and private health sector such as USAID, Accelerator Ghana, NHIS, and the Ghana Health Service. The theme for the summit was engaging the private health sector in the post-pandemic response to accelerate towards achieving universal health coverage in Ghana. In his opening statement, the UNFPA Ghana Representative, AI, Mr. Barnabas Yisa, stated that private facilities and pharmacies continue to serve as a critical channel for last-mile distribution of health commodities, including contraceptives, even during the COVID-19 lockdown, which enabled women and girls access to contraceptives and reduced incidences of unintended pregnancies. In our next story, an 8-member delegation from the Ministry of Economic Planning and Budget, the Ministry of Women Affairs, the Ministry of Health, and the Ministry of Youth and Social Development from Lagos State, Nigeria, paid a visit to Ghana for a 4-day learning tour. The purpose of the visit was for the delegation to come and study how UNFPA works with various governments and state institutions, as well as NGOs and partners in the implementation of its country program. During their visits, they paid courtesy calls on some of UNFPA Ghana's implementing partners and other government agencies to primarily ask questions and interact with heads and staff of these institutions. The delegation also paid a visit to the Accra Digital Center, where they had first-hand interaction with personnel of the Ghana Tech Lab to learn about the evolving digital ecosystem and how young people were being actively engaged through various training and practical activities like coding, multimedia production, robotics, scale-up of business startups, among others. Moving on, UNFPA supported the Ministry of Health to train 33 nurses and midwives as measures to scale up the preceptorship program in Ghana. The 4-day training took place at Kumasi in the Ashanti region, and the main objective of the training was to equip participants with the knowledge and skills on effective precepting. The midwifery focal person, in her opening remarks, commended the Ministry of Health for embarking on this innovative program to bridge the gap between pre-service training and practice. She also indicated that the preceptorship program can be used as an avenue and a vehicle to equip pre-service nurses and midwives with the knowledge and skills to improve the quality of care in Ghana. Madam Cynthia Jojomet, the head of Nursing and Midwifery Health Training Unit of the Ministry of Health, also expressed gratitude to participants for availing themselves to be trained as preceptors. She stated that preceptorship goes beyond contributing to the SDGs, and it should be seen as a tool to train the next generation of nurses and midwives in saving lives and ensuring healthy populations. Speaking on partnerships, UNFPA, in partnership with the Department of Gender under the Ministry of Gender, Children and Social Protection, organized a meeting to review and track progress on the implementation of the adolescent pregnancy strategy that was developed by MUXIP together with other stakeholders. The meeting was meant to engage stakeholders in addressing sexual and reproductive health issues confronting the adolescents, particularly the girl child, in the country. Speaking on behalf of UNFPA at the meeting, Madam Selina Owusu stated that as the implementation of the strategic plan culminates this year, there's a need to enhance our concerted efforts to meet set targets and goals, and to achieve this, we must build on the good practices that worked in the past. During the meeting, participants were taken through institutional framework for monitoring adolescent pregnancy strategy plan implementation in Ghana. And in our last story today, the Special Sustainable Development Goals Advisor to the President of Ghana, Dr. Eugene Owusu, visited the UNI Fellows to discuss possible resource mobilization to help progress the SDGs in Ghana. Speaking to the Fellows, he emphasized on how young people can leverage on their creativity to help solve some of the pertinent challenges encountered with the SDGs. Dr. Owusu stated that 10 out of the 17 SDGs are for the youth, and for this reason, SDGs should not be considered as an abstract or add-ons, but a now or never movement, because young people play a central part in the success of the SDGs. Thank you for joining us on today's edition of 5 Orange Vibes. Don't forget to follow us on all our social media platforms, and do also download the Boami mobile app available on your Google Play Store to report cases of SGBV. Or you can equally call the Orange Support Center on 0800 111 222. Thank you and see you next time. Bye.